Imagine waking up one day and realizing that a silent disease has been growing inside you for years, without you even knowing it. Prostate cancer is one of the deadliest cancers among men, yet most guys don't even think about their prostate until it's too late. The real danger? It starts silently, with barely noticeable signs, until it reaches a point where survival becomes much harder. But here's the good news. Knowing the early warning signs can literally save your life. Today, we're breaking down the 12 crucial symptoms of prostate cancer that most men ignore. Some of these might surprise you, and by the end of this video, you'll know exactly what to watch out for and how to reduce your risk before it's too late. Let's get into it. Prostate cancer is the most common cancer among men in the United States, and it's the second leading cause of cancer-related deaths in men worldwide. Let that sink in. 1 in 8 men will be diagnosed with this disease at some point in their lives. And in 2025 alone, over 100,000 new cases are expected. That's a massive number. But here's something even scarier. Most men don't catch it until it's already advanced. The reason? They either don't know the symptoms or they ignore them, thinking it's nothing serious. And that's a mistake that can cost lives. The key to beating prostate cancer is early detection. Recognizing the warning signs early gives you the best chance of successful treatment. So, let's dive into the 12 early symptoms of prostate cancer and what they mean for your health. The prostate is a small, walnut-sized gland located just below the bladder, surrounding the urethra. It plays a crucial role in both the urinary and reproductive systems, producing seminal fluid that nourishes and transports sperm. Despite its small size, the prostate has a significant impact on male health, affecting both urination and sexual function. When prostate cancer develops, it often does so silently, with no immediate warning signs. In its early stages, the cancer may remain confined within the prostate, growing at a slow pace, which makes it even easier to overlook. Many men experience no pain, no noticeable discomfort, and no immediate changes to their daily routine. This deceptive nature is why prostate cancer is often referred to as a silent killer. As the cancer progresses, however, symptoms begin to emerge. Some subtle, others more alarming. The first indications often involve changes in urination, as the growing tumor starts to put pressure on the urethra. Some men might notice difficulty starting or maintaining a steady stream of urine. Others may experience an increased urge to urinate, especially at night. One of the biggest challenges with prostate cancer is that many of its early symptoms mimic those of benign conditions, such as an enlarged prostate, BPH, or prostatitis, inflammation of the prostate. This can lead to delays in diagnosis, as men may dismiss their symptoms as a natural part of aging or a minor inconvenience. That's why awareness is critical. Understanding what's normal and what's not can make all the difference when it comes to early detection. Recognizing even the smallest change in urinary habits, unexplained discomfort, or unusual physical sensations should prompt a conversation with a doctor. And for men over the age of 40, regular screenings, such as the prostate-specific antigen (PSA) test, are an essential tool for catching potential issues before they become serious. The key takeaway? Don't ignore the signs. Prostate cancer may start quietly, but the earlier it's caught, the better the chances of successful treatment and survival. That's why most men don't realize they have a problem until the cancer has already spread. But if you know what to look for, you can catch it early. And trust me, you want to catch it early. Let's go through the 12 warning signs that could mean prostate cancer is developing inside you. 1. Blood in urine, also known as hematuria. Seeing blood in your urine can be terrifying. While there are other causes for hematuria, like infections or kidney stones, prostate cancer is one of the most serious possibilities. Blood in urine often appears as pink, red, or brown discoloration and may be accompanied by pain or discomfort. Sometimes the bleeding might not be visible to the naked eye, but detected through medical tests. In many cases, blood in urine is a late-stage symptom of prostate cancer, meaning the disease has already progressed significantly. The presence of blood indicates that cancer may have affected surrounding tissues, blood vessels, or even spread to nearby structures, such as the bladder or kidneys. Additionally, hematuria can sometimes be intermittent, occurring one day and disappearing the next. This can lead to a false sense of security, causing men to delay seeking medical advice. However, even a single instance should not be ignored. If you experience this symptom more than once, it's critical to get checked immediately. A doctor may order a urinalysis, imaging tests, or a cystoscopy to determine the underlying cause. 2. Difficulty urinating. A weak or interrupted urine stream, trouble starting urination, or feeling like you need to push harder to pee could all be signs that something is obstructing your urethra. As the prostate enlarges due to cancerous growth, it can press on the urethra, causing these issues. This is often one of the earliest signs that men experience, so don't ignore it. Inability to urinate while standing is a strange yet telling symptom. Some men with prostate cancer find that they need to sit down to urinate because standing becomes too difficult or uncomfortable. This could be because of an enlarged prostate pressing against the bladder or urethra, making urination more difficult. A persistent burning or stinging sensation when urinating or ejaculating is a warning sign of prostate irritation. While urinary tract infections or sexually transmitted infections can also cause this, a burning sensation that doesn't go away should not be ignored. It could indicate that cancer is growing within the prostate and causing inflammation. Do you find yourself waking up multiple times during the night to use the bathroom? This could be more than just a sign of aging. An enlarged prostate can press against the bladder, making you feel the urge to urinate more frequently, even if you don't actually need to go. If this is happening more often than usual, it's a red flag worth investigating. Sudden weight loss without dieting or exercise changes is always a reason for concern. When cancer is present, the body may start using more energy to fight the disease, leading to noticeable weight loss. If you've lost a significant amount of weight without trying, it's important to investigate the cause as soon as possible. Prostate cancer commonly spreads to the bones, causing pain in the spine, hips, or ribs. Unlike normal joint or muscle pain, cancer-related bone pain tends to be persistent and gradually worsens. If you experience deep bone pain that doesn't go away with rest or over-the-counter medication, see a doctor. Feeling constantly drained despite getting enough sleep? Cancer-related fatigue is more than just feeling tired. It's an overwhelming exhaustion that doesn't improve with rest. This can be a sign that your body is fighting off cancer, and it shouldn't be ignored. Noticing blood in your semen can be alarming. It could be caused by infections or minor injuries, but if it happens repeatedly, it may be linked to prostate cancer. Cancerous growths can interfere with delicate tissues and blood vessels in the prostate, leading to this symptom. One of the more serious signs of advanced prostate cancer is the onset of weakness, numbness, or tingling in the legs or feet. This happens when the cancer has spread beyond the prostate and metastasized to the spine. The spine houses a network of nerves that control many functions throughout the body, including sensation and movement in the legs and feet. When prostate cancer spreads to the bones of the spine, it can cause pressure or compression on the spinal cord and nerves. This compression can lead to a range of neurological symptoms, including a sensation of tingling or pins and needles in the lower extremities. Numbness, where the legs or feet feel dead or without sensation, can also occur. In some cases, this pressure on the nerves can cause weakness in the legs, making it difficult to stand, walk, or perform routine tasks. As the cancer progresses, this weakness can worsen, and affected individuals may struggle to maintain balance or coordination. In more severe cases, the compression of nerves in the spinal column can result in the loss of bladder or bowel control. This is a particularly alarming sign, as it indicates that the cancer has significantly impacted the nerve pathways responsible for controlling these vital functions. A loss of bladder or bowel control often signifies a medical emergency that requires immediate attention. If you begin experiencing any of these symptoms, it's critical to seek medical help as soon as possible. Early intervention is crucial, as timely treatment can prevent further nerve damage and help manage symptoms more effectively. Additionally, if prostate cancer is diagnosed at this stage, doctors will explore options to alleviate nerve compression and improve quality of life. Don't ignore these signs. Prompt attention is key to managing the effects of metastatic prostate cancer. Pain that radiates from the pelvic region to the lower back and thighs can be a sign that prostate cancer is growing and causing inflammation. If this pain doesn't go away, even after rest or pain relievers, it's worth getting checked out. Many men assume that erectile dysfunction is just a normal part of aging, but in some cases, it can be a sign of prostate cancer. Cancerous growths can interfere with nerve function and blood flow, making it difficult to maintain an erection. If ED develops suddenly without other clear causes, it's worth discussing with a doctor. Recognizing these symptoms early can make all the difference. If you're over 40 or if prostate cancer runs in your family, it's time to take this seriously. Regular screenings like PSA blood tests and prostate exams can detect cancer before symptoms even appear, increasing the chances of successful treatment and survival. Many men avoid these screenings due to fear or discomfort, but the reality is that early detection can make treatment less invasive and more effective. The PSA test measures the level of prostate-specific antigen in the blood, and an elevated level may indicate prostate cancer or other prostate conditions. A digital rectal exam, DRE, allows doctors to physically check for abnormalities in the prostate. It's essential to understand that prostate cancer, when caught in its earliest stages, has a nearly 100% survival rate. However, once it spreads beyond the prostate, survival rates drop significantly. This is why routine screening is crucial. Lifestyle changes also play a role in prevention. Eating a diet rich in fruits, vegetables, and healthy fats, while avoiding excessive red meat and processed foods, can help reduce risk. Regular exercise, maintaining a healthy weight, and avoiding smoking further support prostate health. If you experience any of the symptoms mentioned, don't wait. Seek medical advice immediately. Taking charge of your health today could mean the difference between life and death. To recap, understanding the 12 early warning signs of prostate cancer is crucial for early detection and treatment. These symptoms can appear subtly at first, making them easy to overlook, but identifying them early can significantly increase the chances of successful treatment. If you notice any of these warning signs, do not ignore them and seek medical evaluation as soon as possible. Regular screenings, such as PSA blood tests and prostate exams, are critical in catching prostate cancer before symptoms even appear. Awareness and proactive health measures can save lives. Here are the key warning signs: blood in urine or semen, difficulty urinating or a weak stream, burning sensation during urination or ejaculation, frequent urination, especially at night, unexplained weight loss and fatigue, bone pain and numbness in legs or feet, pelvic pain and erectile dysfunction. Early detection saves lives. If you notice any of these signs, don't wait. Talk to your doctor and take control of your health today. If this helped, subscribe for more life-saving health tips.